Veterans Healthcare Policy Institute, an organization founded by veterans, healthcare providers, and journalists. Our discussion today will be updates on COVID-19, dishonorable discharge, impact on veterans' healthcare and benefits, and the USPS slowdown, impact on veterans' medications. But first, I want to open it to Cliff Kelly, who is our host. And Cliff, how are you doing today?
I'm doing great. How are you, Colonel?
Oh, fine.
Everything going all right? Yeah. Sometimes I get accustomed to being on talk radio, But all sorts of things going on, But before, just let me. Can I have just a second of your time? I just want to.
Oh, yes, sir.
Bring something up that I thought was amazing. I happened to see it earlier. There were some ladies. Two of them, Colonel, were they were celebrating their 90th something birthday, but they were involved with those women. They were children. They were teenagers at the time. They are the ones who came up with that code that the Japanese couldn't break during World War II.
Oh, yes, sir.
You probably read about that.
Oh, yeah.
Yeah. I mean, just all kind of amazing things. To think that the war is that old too, but I just thought it was amazing for them to come on, and it's a great thing when you think about it. Over 80 years old. Yes. Anyway.
Yeah, well, one of the things, Cliff, is that I'm not the governor of talk radio, so one thing I wanted to make sure we paid attention to is that America's Heroes Group is proudly sponsored by attorney Steve Seidman of Seidman, Margulis, and Fearman, LLP, 20 South Clark Street, 2 First National Plaza, Suite 700, Chicago, Illinois, 60603, toll-free number 888-837-3275, office number 312-781-1977, and I'll be taking care of partaking in his services as well some point in time with my Veterans of Benefits Affairs. But also we have America's Heroes Group is proudly sponsored by Pearl's Place, Down Home Southern Cooking, 3901 South Michigan, Chicago, Illinois. Their phone number is 877-275-5852. And I know you've been there a couple of times, Cliff. And then America's Heroes Group also is proudly sponsored by veterans business owner Here's Gulf Shrimp, 7448 South Vincennes Avenue, Chicago, Illinois, 60621. And call 773-783-1818. And we have the panelists who are online now.
Yeah, go right ahead.
Yeah, so we have Brett Copeland, who is the VHPI Executive Director of the nonprofit Veterans Healthcare Policy Institute, an organization founded by veterans, healthcare providers, and journalists. He's going to give us an update, Cliff, on the COVID-19 and dishonorable discharge impact on veterans' healthcare and benefits, the USPS slowdown, impact on veterans' medications distribution. Okay, nice having you on board, Brett.
Well, thank you, Colonel Arnold, and I have to say it's an honor to be back on the air with Mr. Cliff Kelly. So thank you for having us, and glad to have you back.
Thanks so much.
So at the Department of Veterans Affairs currently, there is nearly 4,000 active cases of COVID-19. Since the pandemic has begun, they've seen about 46,000 cases. Now, that's relatively low compared to the United States national caseload, which is about 5.35 million. With nearly 170,000 dead as a result of that. At the VA, because they responded so quickly and put in important protocols and programs to make sure that spread did not occur as quickly, they are seeing a much lower death rate. Currently, only 2,434 people who have been at the VA have passed away due to COVID-19.
Oh, boy.
And I think that is particularly an important thing to look at because the VA has essentially 4 missions. Of course, delivering care to veterans, the care that they were promised. But also research and teaching is their second and third mission. And their 4th mission, which has been implemented since the global pandemic has broke out, is providing emergency health care to all Americans as America's emergency health care system. And that came into play over the last month in Texas, where a Texas hospital, rural Texas hospital, put together an ethics committee that essentially would help decide which patients would receive life-saving care while others would be only given end-of-life care. They had 28 beds in this hospital. 27 of them had someone in it who had COVID-19.
Wow.
So they were facing an incredibly terrible decision that they had to make. But luckily, they never had to make that decision because the Veterans Health Administration or the VA stepped in under the fourth mission and helped them build their capacity at that local hospital and transferred those patients over to Audie Murphy in San Antonio.
Fantastic.
Yeah.
This is a success story. Yeah.
I think that, and one out of every 3 VA employees is actually a veteran themselves. So these are people who are committed to serving the nation, who have put themselves on the line for the nation before and are doing it again by helping combat the global pandemic on the front lines, truly. This last week I was talking to a lot of veteran service officers at the county level in Florida. And I think what they're waiting for and kind of what we're waiting for over at VHPI is to see what the next couple of weeks are going to look like as schools get back in session and as a lot of snowbirds in the north currently are wrapping up their summer season and going back to warmer climates down south in Florida, Texas, Arizona. And a lot of those folks are veterans, of course. And talking to these veteran service officers in Florida, they're really worried about it. Pretty slow for them right now, work-wise, but they're anticipating really having a lot of work coming up here in the next couple months. So we'll be interested to see how that plays out, and hopefully precautions are taken and the VA continues to be ready because I think there could be another wave coming.
Okay, if you have comments or questions, please call in at 773-591-1690, 773-591-1690.
Right.
And one of the things that we mentioned was this impact of the USPS system on the slowdown of medications, I guess, going to veterans. Can you mention a little bit about that?
Absolutely. Well, this year, veterans made about 11.2 million prescription refill requests through My Health Vet, which is an 8.1 increase compared to the same time period last year. So veterans are really taking heed and being leaders on containing community spread. They're staying at home, they're doing things online, and the VA is providing them tools to do that. So I think that, veterans, especially in rural areas, the VA fills about 80% of veterans' prescriptions by mail. That's about 120 million prescriptions a year to about 330,000 veterans across the country. It's unfortunate that the President Trump has pretty blatantly said that this is the slowdown is to slow down mail-in voting. Regardless of what your politics are, the reality is that veterans are not getting their prescriptions in a timely fashion. And timing is so important.
Did you say they're not getting the prescriptions in a timely fashion?
Correct.
Yeah,
and when it comes to taking blood pressure medication or getting your insulin shots, timing is so critical. You can't miss.
That's important, right? Yeah.
Yeah.
So veterans, are already at a high risk because of the conditions that they developed as a result of their service. So kind of adding another thing on and not letting them get their medication on time, that can play a huge toll on their health. And we really want to keep veterans not only safe during the pandemic, but not having to be stressed out, wondering if that medication is going to get to their doorstep on the right time. They've got plenty to think about already,
Yes. And what about the dishonorable discharge impact on veterans' health care and benefits? I guess they have to go through a certain pathway in order to be recognized as far as health care benefits, or they have to, the things that have to be done. And I'm not sure about how that pathway works.
So discharge status has a huge impact on a veteran's life after service. A lot of homeless veterans were likely discharged other than honorable or dishonorable and didn't have the resources that other veterans were promised when all veterans were promised when they signed up. So discharge status really limits the benefits and the health care that you can receive and who will help pay for that. In LA, they have a tent city essentially set up for homeless veterans that they're providing care to who wouldn't normally get health care, mental health care, because it's a really decent-sized group. But between the year 2000 and 2013, 1,467 service members were given dishonorable discharges. That's about 150 per year over a 10-year period. And in addition to kind of limiting what they're getting, they're also not eligible for things like job training, connections or resources like that at the community level. So it's a hard hole to dig yourself out of if you are labeled with that other than honorable discharge status. And through our investigations over the last month or two, we found that especially since the War on Terror began, discharge status has been handed out not just for legitimate reasons, but as an act of retaliation and warning by superior officers to try and make an example out of these folks. So we're looking more at that, but it definitely, we're having a panel on the 25th, and we're having a veteran on who has a dishonorable discharge, Christopher Goldsmith, and he talks about his struggles with mental health and suicide crisis as a result of that. He's an advocate now for veterans. Michael Blecker, who works and advocates for with Swords to Plowshares, a group founded by Vietnam veterans who helps homeless veterans with job training and housing. And then Major Danny Gerson, who's a retired U.S. Army major and author of Ghostwriters of Baghdad and Patriotic Descent, who are going to talk about all angles, whether you're an enlisted person who got a dishonorable discharge, whether you're in a command position, or whether you're trying to pick up the pieces after our armed forces come home.
Yeah.
So that's on August 25th, and if you go to veteranspolicy.org, you can find out where to sign up for that.
Great.
Veteranspolicy.org. Okay, we got to get that and take a look at that. But one of the things that you were mentioning something about the mask a little bit, and I always say that there's like we have a saying slogan out there, just do it. I say just wear it. Make sure that people wear that mask.
Yeah, right.
And we need to have a new slogan for that out there.
That's right. That's right.
But I kind of look at that as being wearing out body armor. When we were in combat overseas in Iraq, Afghanistan, other regions of the world, Vietnam, service members wore their body armor because they knew that without wearing that, they would be subject to incoming shrapnel or rifle fire, right? And so just wearing and that was 40 to 60 pounds. When I was in Iraq, it was 40, 60 pounds of body armor, and it was 130 degrees in the shade, right? And when I see people walking around without masks now, they weigh less than 2 ounces, and it's not exactly 130 degrees out there. And people walking around our veterans, exposing them and that kind of thing, and our seniors, I think it's something that we really need to really push for more. And, from a veteran standpoint, we need to comply and make sure that we are protecting everyone in our communities. But you also, mentioned that there was the healthcare thing. So COVID-19, how is that affecting access to care? How are veterans getting into services, and how do you see that playing out for our veterans? Because some people...
Well, we hope that veterans will know that they can go to the VA regardless of whether discharge status and just try and get into the system. The VA is going to be providing care on an emergency basis right now. A lot of veterans lost their jobs earlier this year, continue to have a high number of unemployment. So we want to make sure that those folks are going back into the VA and knowing that that is available to them. Already, 1.6 million public sector jobs have been lost, and the public sector is where most 13% of all veterans work for state and local government. So those massive budget shortfalls that, unfortunately, the U.S. Senate went on vacation this month before they passed another aid package.
Yes.
And veterans are going to be among people who are hurt by that. talking about masks again. It's the easiest way to say got your fix is to wear that mask right now, because unfortunately, a lot of veterans, that's all that they've been left with by this Congress at this point.
Yeah, but it's a good point, Brett, because it's almost like a double attack on their family, because if you don't have your, access to the medications, your veterans benefits, the health care, and then your spouse may be working in a regular job that now is also impacted, so where do you turn? And we can't dishonor these veterans. We need to restore the honor and valor of our veterans who are out in the community.
Yeah, absolutely. Well, Dr. Arnold, you're running the show today. Are we to take a break yet or not?
Oh, yeah, we have a minute to go. We're actually getting to the.
Okay. I thought we were getting close. Yeah.
Yeah.
Okay.
If Brett, maybe you can give us like an overview and give us those contact numbers again. The
that would be great.
Yeah, and how can people participate in this process and make it better for our veterans?
Well, I would say that people need to especially keep wearing the masks. We're coming into the fall season, and a lot of those folks are going to be traveling to their summer residences and schools back in session. So by protecting ourselves now, we can help protect our veterans over the next couple months. But be sure that you let people who represent you in Congress know that veterans rely on the USPS, United States Postal Service, to get their medications on time. And it's the very least that we can do is ensure that veterans are getting their health care and getting their medications so they can go on with their lives and do other things. We are going to be talking about dishonorable discharges and its impact on veterans' health and mental health on August 25th. And you can go to www.veteranspolicy.org. Sign up for our newsletter, and we'll get you that news and get you into that session. It's going to be a great program.
Well, great
information. Great information.
Yes. Right. And one of the things you were mentioning, because your group is the Healthcare Policy Institute, and so you're really dealing with policy. You're dealing with healthcare providers and then journalists as well. So we had to really come back and have you on a show. To talk about the policies that you're generating through your institute, and how you're doing things from a policy perspective. Anything new that you're really looking at? Yeah.
Well, we are continuing to follow kind of the implementation of the Mission Act, and especially since it was begun again, where veterans are being able to access care outside of the VA. Sounds like a good thing, but unfortunately the VA is being dismantled while that money is being pushed out into the community. And like with medications and the USPS, veteran care in the community costs more, especially in rural areas like me. There's only a few providers. Thank God we've got a VA here to provide for our local veterans. And if care can't be provided here, they find a place to send them in a major veterans hospital nearby.
Well, we have